you've mentioned that you've noticed this tendency that problems that healthcare professionals have started while they were in school, basically. How do we help them? Like, what are the tools? Because I imagine, like, even in school, there's also a tendency of not seeking out help, right? Of this is what a student is supposed to do, kind of the grind, I imagine, like long hours. So yeah, what do we do with that?
Yeah, I mean, there's kind of been a tendency historically of like, I had to suffer through this, you should too.
That's true, yeah.
And so there's really a movement in the whole field of healthcare now to put a stop to that cycle, that we're realizing, why are we eating our own? Why are we doing this to our trainees? Why are we perpetuating what was an unhealthy environment that we experienced? Why would we want to do that to someone else? And so, again, it's wonderful because this whole field is sort of burgeoning and growing, where there's an increased understanding and an increased willingness and dedication to doing something about it. So what I will say, what the answer is not, is to tell people, like, just take a yoga class. And unfortunately, that was, again, traditionally what the response had been. And so there's still quite a bit of cynicism across many healthcare professionals about, what wellness is, or what it means, or why would you have well-being programs, or what's the point, because, the system is broken. And so now the strategy is really much more comprehensive. So as the director of wellness programs for the College of Medicine here at UF, I use what's called the Stanford model of professional fulfillment as sort of the guiding framework.
Okay.
And I like that model because they put the center goal is professional fulfillment. So what that means is we're trying to create an environment where people are happy at work, they find meaning in what they do, they're feeling satisfied with their job, they feel supported by their colleagues, that, people who become a physician have spent decades of their life preparing to do that. And so we would hope that they're actually finding fulfillment in practicing that career, right? Same with any other health professional. So in the model, though, you have, that's the center, that's the goal, and then there's 3 components that play into that. And the first is the culture of wellness. And this is something that is part of the organization, the institution, the environment. How does it feel when you come here to work or to learn or to train? Is it full of collaboration and cooperation and good communication? Or is there a lot of conflict and competition, right? So it's a lot of C words, but it gives you a picture of, what it feels like. Do you feel supported by your colleagues? Do you like them? Do you have relationships with them? Is this a place where you are happy when you're walking into work? The second component is what's called efficiency of practice or efficiency of process. Sometimes it goes by different names. And this is, again, an organizational, institutional issue. How is your work environment set up to make it easier or harder for you to do the work that you do? So how much time do you spend on, unnecessary bureaucratic paperwork, on meetings that go too long? How many hundreds of emails do you get every day? How many other types of communications are you expected to read? So with a clinician, they have their email, they have their text messages, they might have their secure chat messages, they have MyChart messages from their patients, they have other messages coming through the electronic medical record from other clinicians. It just becomes overwhelming, and people have this immense cognitive burden, because how can you keep track of all of these things, And so it's hard to really focus on doing the work that they're there to do, which is to care for patients. Physicians are happiest generally when they're engaged in patient care. And there's data showing that, especially in some specialties, physicians now spend more time in front of a computer than they spend in front of patients. And that's not why they went to medical school, right? That's not why they dedicated their 20s to a residency program. It's they want to do good and be helpful and heal people. And so the more required online trainings you have and the more check boxes you have to click and everything else. All of those things detract from the experience of professional fulfillment. And so another component is, trying to do what's called job crafting and matching people's job tasks with what they find most enjoyable. So, for example, at an academic medical center like here, there are various things you can do. You can be providing direct patient care, but you might also be doing research, or you might also be teaching, and that might be classroom teaching or bedside teaching. And so different people enjoy different things, and maybe at different points of their career, they have different interests, or, it fits better or worse based on what's going on in their home environment, those kinds of things. So again, connecting, making that match between how can I work efficiently doing a job that I like, that's part of the thing that the job can help with, right? And then there's technology too. So Zoom has been very helpful in some ways because, you don't have to drive across campus or across town to go to meetings anymore. But it also is a detriment sometimes because having that in-person connection is super important. Same thing with the electronic medical record. There used to be a lot of good collegial collaboration that would occur in the nurse's station around the paper charts because everyone had to go there to write their notes in the same charts. They were all, forced to sort of
physically be near each other, right?
But now everyone's sort of in their own silos at their own computer, and you may not see the other people who are caring for your patient. And it's those incidental, bumping into people where that can actually make patient care better because you have opportunities to ask these questions or to provide some feedback or things that maybe you don't want to take the effort to send an email about or whatever. But if you see the person, you can kind of discuss it in the moment. And just getting to know your colleagues better so that, again, it feels more supportive and friendly when you're there. And then the final component of that framework, the professional fulfillment, is personal resilience. And that's the part that usually gets all the attention, right? That's eat well and get enough sleep and exercise. Doing things like yoga and meditating are great. Right. And there is a lot of research, particularly to support the benefits of mindfulness and meditation in healthcare professionals. But that's not enough to overcome the organizational part.
Exercise, nutrition, as you mentioned.
Right.
Those three, maybe you could call them, or there's probably more.
Yeah, there's a lot more. I mean, it's, if you need therapy, if you need some counseling because you're feeling depressed, or you need some coping skills, or you need mentorship, or whatever it might be, there are things that we need to do personally for our own, self-care. But self-care is not enough to counteract a toxic work environment. And so it's those other two components, the culture of wellness and the efficiency of practice, that really a lot of times drive these experiences of burnout and exhaustion and, moral injury.